degrees of severity of that periodontal disease. The lower the defenses are, the more severe the infection is going to be. And usually it also appears when the patient is younger. So when we see those young patients that come already with periodontal disease, that would account for what we call an aggressive periodontitis because it happens a lot younger. That means that their defenses are really low. Now, that having said, it goes with the fact that the amount of bacteria that is in the mouth of that patient is higher than what the patient actually can tolerate. Why? Because defenses are low, we need to maintain the bacteria low. If the defenses are higher, we can tolerate a little bit more, bacteria in our mouth. Also, what happens is that we've seen through research and by analyzing the bacteria that the type of bacteria of a periodontal patient is also different. Why? Because we all have a balance between good and bad bacteria, and in health, the good bacteria is in abundance. And then we have very little bad bacteria, the damaging bacteria, because our defense mechanism and our oral hygiene maintain that low. But if the defenses are low, there's nothing fighting that bad bacteria, and the bad bacteria starts growing. This is the bacteria that causes the tissue damage. They're called, if you heard a little bit about bacteria, there's gram positives and gram negatives. The gram positives are mostly considered like the good bacteria. The gram negatives are the damaging bacteria. They secrete some products that they damage our tissues and they produce the bone loss. We see that periodontal patients have very high numbers of that bacteria, especially below the gum tissue. Why? Because that bacteria is what we call anaerobic. That means that they live without oxygen, and below the gum level there's no oxygen, so they love it. They thrive over there because there's no oxygen, it's warm, it's wet, it's cozy, and
Perfect environment for them.
perfect environment, right? So that's why we have seen then all these factors. So just to summarize, we have a patient that their defenses are lower, so that's genetics, right? That the amount of bacteria has changed, so we know that there's a difference on the type of microbiota, the type of microorganisms, and also the amount of bacteria. So sometimes there has not been the amount of care that that patient needs, right? Because probably they still brush their teeth, but not as much as they need. That patient has very high needs, because everything else is not working properly. So that in a nutshell gives a very good overview of what periodontal disease is and how it happens.
Yeah, that is so important, and a lot of the viewers might have questions, and I will just ask for some of them to actually join our live. And many people just send your questions, send your requests about your doubts about this gum disease and how it happens. Dr. Munné has been taking us through a roadmap basically on what it is and why is it continue to spread across our cities and across our patients. And so how often do you see this happening on your patients, and what are the usual aspects they talk about when they come and they notice something is wrong with their gum disease?
Very good question. So we still see that periodontal disease is very prevalent. We see that there's about 75% of the population that have some form of periodontal disease, more advanced or less advanced. And just to say that gingivitis, which is an infection of the gums, an irritation of the gums, that's very common also. And that's the first stage sometimes of periodontal disease for some patients. And that's very prevalent. And we have done a fantastic job by preventing decay. You see that younger populations, the younger the kids now, the teenagers, 20-year-olds, we barely see any decay. Why? Because parents have been really good about taking those children to the dentist, and they have done the sealants, and they had cleanings regularly. So by the time that they get 15, 20 years old, they still don't haven't had any cavities, or very few.
Very few.
And we know that preventive dentistry works. So that's why it's important to take the children to the dentist. But the same thing is important for the adults to go to the dentist, because we see that preventive dentistry it works in children's and in adults. And then after the kids, they're become already an adult, then what happens? Well, then sometimes neglect starts to happen, because maybe now we don't have the visits to the dentist. And there's several reasons why there's still so much periodontal disease. And that's something that, as a periodontist, I want to do something. I want to help the community to make sure that we prevent it, because periodontal disease is totally preventable.
Yeah.
And there's several reasons why patients still have it. Number one, it doesn't hurt, so it does not have any symptoms. So some patients do not know they have it until it's really very advanced.
Wow.
And if there's no a regular visit with the dentist and emphasis placed on examining the gums and taking x-rays, well, sometimes it only gets diagnosed with the x-rays. So it's important that you go to the dentist, you have regular cleanings, and that you brush your mouth, because oral hygiene is going to be key to prevent periodontal disease. Because if your defenses are lower, we cannot change that, but we can change the amount of bacteria that we have in our mouth just by having a very thorough home care. And in our office, we make sure that patients get very well educated, so they know exactly what they need to do, how they need to do it, and get the results that they need, so they can act like a normal patient. Because periodontal disease and the treatment of periodontal disease is not something that has to be done continuously. It's only done continuously when prevention is not done correctly. But if the prevention is done correctly, it should make sure that gum disease treated with deep cleaning does not have to be redone. If we do surgery, it does not have to be redone.
Good.
And when it's redone, it's because that maintenance was not adequate to the patient's need. And the maintenance consists of the cleaning at home and the cleaning at the dental office. So something is amiss. Either the patient needs to brush more thoroughly to eliminate more bacteria to match their defenses. So if the defenses of the patient are very low, the home care has to be even better, because the bacteria has to be very low. If the cleanings at the dental office are every 6 months, that might not be enough. Maybe normal periodontal patients need a cleaning every 3 months.
Wow.
I would say the norm. Some patients need every 2, some patients need every 4, but the rule is like 4 cleanings a year for periodontal patients. Most patients will do well. But with time, if the patient starts thinking, well, maybe I can go with less, sometimes it's not enough. And that's why, there's recurrences, but it's totally preventable, and it's not something that should be ongoing. So I just want to make sure that our listeners today know that if you feel like you have periodontal disease, you can control it. You can go get a good professional, go see a specialist, and well, first check with your general dentist. Maybe they can treat over there, but depending on the degree, you might need to be seen by a specialist. And we specialists can see patients that sometimes they refer themselves, to make sure that everything is okay. And if everything is okay, you don't need to do anything but just continue to maintain. Maybe not so often if you don't have gum disease, but if you have gum disease, it's important that we catch it early.
Yes.
So the earliest that we catch it, the better. And the more education that we do, the better. And if you have doubts, just be seen and let's check it out. And hopefully you don't have it, but if you have it, you can beat it, and with the help of the Lord, everything can be done.
That's correct. Thank you so much, doctor, for this information. And remember, do not hesitate to ask those questions below. We appreciate all the viewers, everyone who tunes in every Friday. And we are doing it consistently so you can have this information and those answers, from a professional in the industry. We thank you. We'll see you next Friday. Thank you so much. And we'll have more with Dr. Munné, Coffee with Dr. Munné. We'll see you next week.